Hey guys, Dr. Ian here. Today I want to show you guys how to self-assess and potentially self-treat your low back pain in the comfort of your own home. This is an assessment that I do with all my new patients that have low back pain because what we're looking for is what's called a directional preference. So what a directional preference means is typically with low back pain, the pain itself gets worse if we repetitively load our patients in one direction of movement, and it gets a lot better if we load those joints in a different direction of movement. And this is very important because if you can, narrow down and nail your directional preference, it becomes very powerful because you can self-treat and manage your low back pain on your own. And that's important because you're not always going to be able to get into a doctor's office on the weekend or whatever when your low back pain's flared up. So the way we do this in the office is we start with some general ranges of motion. Now it's more complex, but I'm going to give you the basics today. So typically if I'll say I have low back pain on the right side, right through here, it's into my glute and even my upper hamstring, just dull ache, and it gets a little bit worse throughout the day depending on what I'm doing. So that's the case we're working on today. I'm going to have that patient stand up. We're going to start with just some general range of motion, and I'm going to have them glide their hips from side to side. The reason I check this is a lot of times it's going to make that hurt worse, or maybe you'll notice from side to side, in this case, I can go pretty far to the right, but I'm locked up and it really hurts to go to my left. So we're going to note that. You would want to note that at home is if I glide my hips to the left, it's pretty sore. It's okay this way, and I can only go this far, okay? That's the first range of movement we're doing. The next two are going to be more telling. So the first thing I always have people do after that is place their hands on their legs, and we're going to bend down as far as we can, all the way to the very end range. So from the side, you'll see I'm just bending, keeping my knees locked. I'm flexing my low back as far as it will go. We come back up. The patient tells me, yeah, it hurts a little bit worse than it did before. I was a 3 when we started. Now I'm a 5. Okay, that's noted. I can't do that at all. Now that hurts worse. This is unchanged. So now we have two different findings that show us, yes, I have less range of motion and my pain is worse. The other thing that can happen with these assessments is you'll see the pain move. So maybe at that point I'll say, all right, Ian, let's bend forward 10 times and just see what happens. So I will make them bend forward as far as they can go 10 times. And the more they do it, it just gets tighter and tighter. It hurts a little bit worse. Sometimes we won't finish the 10 reps because pain will begin to get further away from the spine. So it started here and here. Now it's all the way down in my calf. That's not a good sign. We're moving the wrong direction. We always want to see the pain move out of the leg or the extremity back towards its source near the spine. So at that point, we're going to halt the flexion. We're going to move into extension. So extension is bending backwards. I'm going to keep my legs straight. My feet are shoulder width apart, and I'm bending back, not halfway. I'm bending back as far as I can, and then I come back up. Now, a lot of patients will say, it hurts really bad to do that right on the spine. I'm okay with that, as long as the pain is midline or close to the spine and not branching or moving farther away. So a lot of times we'll see it in the hamstring. We'll do 1 to 10 of these extensions, and it's like, hey, it's only in my glute. It's at the base of my spine only. It's no longer in my leg. That's called centralization. That means it's moving back towards the center. That's a great sign. So at that point, I would halt the assessment in terms of the directional preference assessment, and we would just work on that from there, having that patient on the hour do 10 extensions as far as they can go in standing. Now, if you were somebody that got better in flexion, so, they say, the more I do that, I've got better flexibility. I can move farther and the pain's out of my leg. It's only in my low back. We would work in flexion. I will tell you that most of my patients have an extension bias. In other words, the extension is what helps, not repeatedly flexing them. That's most people. But there are people that respond to flexion. So you've got to be, open to the idea that, repeatedly flexing your lumbar spine might actually help you. But if we find that directional preference, like I said, for most people, it's extension. We would do that on the hour. We would do 10. There are other variations that you can do, and I'm going to walk you through the variations of the extension and the flexion exercises now. All right, guys, so now what we're going to do is cut that. Okay, Now, guys, what we're going to do is go through the different progressions you can do at home if you're an extension biased person. In other words, your low back pain gets better with extension. You can move from standing to a McKenzie press up. My hands are just below my shoulders and I'm pressing up until my elbows lock out. The key here is you want to relax your glutes. Don't squeeze your butt. Relax it. Breathe out, and you'll notice I get a little extra extension in my low back, and then I can come back down and come right back up, doing that 10 to 15 times. Again, I typically have my patients do it on the hour. The other thing you can do is do what's called a low press, where you just hang out on your elbows. And for my patients, a lot of times I'll have them just do this in the evenings when they're hanging out at their house. You can do it. You can kind of do a low press up if you're in a lot of pain, but you can also just hang out here for 3 to 5 minutes, and you'll notice that a lot of times your pain will be better. You want to be very careful getting up out of this position, but this is a great exercise as well. So again, a full press up or just the low press up for 3 to 5 minutes, or you can do the repetitions with both, which would be 10 to 15 if extension makes your low back pain better. Okay, so we talked about the possibility that flexion would make your low back pain better. So now I'm going to go over a couple progressions on how to do that in different positions. Again, flexion and standing is just bending forward with your legs locked and your hands on your legs as far as you can. If you want to you can do it in lying, and some people respond better to this. And we're going to bring our knees, pulling them up until we get to that end range of motion. You don't have to yank. You're just getting flexion, and you come back out. And so it's the same thing as in standing. We want to do this repeatedly. Typically, I'll have my patients do it 10 to 15 times on the hour. Again, most people, not most, but it's more common to be an extension responder. But if flexion's your thing, this is a great exercise for this. And I've got one more progression of flexion to show you next. All right, guys. So now I'm going to walk you through another progression or another alternative to flexion low back exercises. This one done in the seated position. What you'll do is slide to the front of your chair. You're going to spread your legs apart because you're going to be reaching down like you're trying to reach those back legs of the chair just as deep as you can go, rounding your low back forward, and then you come right back up. You would just do this repetitively like you would in standing. Again, I have my patients do it 10 to 15 times, at least on the hour initially. As they begin to get better, we taper that down. So this would be another alternative for flexion, and this would be flexion in sitting. Hope this helps, and we'll talk to you soon.